it's really my great pleasure to introduce Rachel because since I joined CTAHR in 2019, I've gotten to know Rachel and her work much better than her team. And getting to know her actually led to our recognition in 2022 for her excellence in research. And so she was awarded, in addition to the Scientist of the Year award that you guys are giving, we awarded her the Dean's Excellence in Research Award in 2022. She was recognized at our May banquet. So it's really a great pleasure to see her continuing to get the recognition she deserves. She's the type of scientist and teacher and person that we can all aspire towards being. She's done an excellent work. She's really dedicated to the university, to the islands, and to the betterment of particularly children's nutrition. So I would like to cite that some of the outstanding contributions she's made here, particularly in terms of mentoring 50 graduate students and 15 postdoctoral candidates in nutrition epidemiology, and the fact that she's also mentoring many of our young faculty who are involved in her program as well, in HINFES, in nutrition, and in the CHILL program specifically. Rachel has obtained more than $40 million, at least last count, it's probably still going up, more than $40 million as principal investigator of federal grants, including the $25 million grant that helped establish the Children's Healthy Living Program. Right? Again, that's when it really took off. And more recently, an additional $10 million award to expand the program into a center of excellence in food system resiliency for children's healthy living. So it's my great pleasure to introduce Rachel, and I look forward to her talk because I'm going to join you. I'm going to stay and appreciate this opportunity. Thank you.
Okay. Yes.
I don't know if you thought Jessie. Jessie was a 2020 ARCS scholar, so we're
Thanks to Dr. Novotny, she nominated.
I'm working with Dr. Novotny now, so we're delighted that she could be here to join us. And this is your official bowl as our Scientist of the Year. So let you get started.
All right, thank you. We want to adjust the lights or we have?
Oh, yeah, let's do that. I can do it, Jess. Okay, thanks.
All right, is this a good spot for me? Thank you for being here. I look forward also, as Walter said, also to getting to know this group. Not that familiar, so I'm very pleased to be here with you, and really am honored that you thought of me. And so, thanks again. I hope we can continue the conversation as we go forward. So I'd like to share with you a little bit about the Children's Healthy Living Program, and tried to keep it kind of broad while still giving you a sense of the actual research. So as Walter said, we've had 3 grants now supporting this program, although it was a continuation of a lot of our earlier work. I do want to start out kind of both reflecting back at our ancestors and the indigenous people in the region, which we have prioritized in this work. Think about being in the context of respecting nature and looking forward to the children and to the future. And so we were in the context at the time that we were writing this grant of a declaration of emergency by the Pacific Islanders Health Officers Association due to rates of chronic disease in the region. And so this was the context in which we were coming together for this activity. So we, as a group, the group of us that worked together on CHILL, came together to envision sustainable community-based systems and environments to raise healthy children in the region. And in particular, to build a partnership and work on building capacity in the region so that the environment, particularly the food and physical activity environment, were more conducive to children's health. So really making it easier to be healthy, change the world around us to result in better health and prevent obesity, which is an important precursor of chronic disease. really primary prevention at young children to prevent disease. And we have found and started out believing, but it has been powerful for us to have a focus on children. It is certainly a legacy. It's certainly a way to think about the future. And as I say, it's really primary prevention, really preventing that disease, not only treating it. So we turned it though to be promotion of health, to really be looking at what we could promote, what we could build on during this critical period of development, and what family and society is not going to care about their children. So it served as a really helpful way to work with communities. So our goal then was to build the social, cultural, political, economic environment around children to be more supportive for being active and for eating healthy food as a way to prevent obesity. But we really focused on health, really wanted to turn the emphasis towards what can we do to be more healthy, what our communities are already doing that promotes health that we can support more of. When we know what doesn't work, we still don't necessarily know what to do, but when we know what to do, we can do more of it, right? So that's really our basic philosophy. So again, we this as a CAP grant, which is this type of grant, we included, like the land grant mission, research, training, and outreach. So the training piece you see displayed here went throughout. We had trainees who participated in a variety of these activities. We did research, a community-based trial, which I'll tell you about, and we aim to use that information for policy change and make it available to communities. This is a region. This is the region we were working in. So these 11 jurisdictions that are named here, which all have a U.S. affiliation, but are not part of the National Health and Nutrition Examination Survey of the United States, even Hawaii and Alaska. So one of our goals was really to provide basic information on the health status in the research domain, as well as conduct this intervention. We all, interestingly, have a land grant college, even though we're very diverse, and these countries in orange are independent, so this land grant development was from the trust territory period. So it became a really important way for us to organize something we had in common when so much else about our environments was different, including language, 11 languages in this region. So we were aiming to provide this basic data. We came up with several key partners, which were the colleges and also the Head Start programs, which also developed back around that time. And although in some of the jurisdictions they're no longer funded, that structure had remained in place and a way for us to work with the children. I'll tell you a little bit more about acanthosis nigricans, which is a skin indicator of insulin resistance. And so that became another tool to help us get a clinical indicator of that chronic disease that was developing in children. We also, for the training program, began to develop classes online so that we could provide more training. Most of these jurisdictions have community colleges. And so there's really sort of a glut of education at the AA level and not much opportunity beyond that. So we're kind of targeting that area there. Although we did also work closely with University of Hawai and University of Alaska in providing degree opportunities along with us here at the University of Hawaii. So this is the way we're organized, and we're still organized. So we have a coordinating center here, we have a data center, a training center, an extension center. And then we developed, after this first wave of the grant was over, we developed a multi-state project thinking, okay, how are we going to sustain this activity? We're going to keep seeking grants, but let's make use of this multi-state project network, which is also among land-grant colleges. And so we developed a multi-state project that also continues now. So we have a steering committee of these people, leaders from all of those places I showed you. I neglected to point it out that the ones in blue participated in the intervention trial that I'll tell you about, but all of them participated in that baseline data collection to provide prevalence descriptive information. So this is the timeline. So this first grant provided that preliminary data for prevalence or baseline. And we also did a lot of work with communities to develop our intervention or trial. So a lot of meetings with communities that I'll tell you a little bit more about to get their ideas for how to intervene. Then we did our intervention, we followed up, and then we did what we call a delayed optimized or a shortened intervention among the control group. And then with our second grant, we did a long-term follow-up of our effect. And then now, as Walter mentioned, we're moving on into a focus on the food system and resiliency and using all these data for modeling, which I'll be telling you just a little bit more about. So I just wanted to highlight, so this is our current structure, these things I've mentioned, but there have been other grants that have contributed, and indeed, even before CHILL, actually decades before CHILL, there was Healthy Living in the Pacific Islands and several other collaboratives. And I say this because it isn't, a lot of this is built on relationships. And so it isn't the type of work that you could really just do immediately in that first year if there wasn't quite a bit behind it already. Okay, so let's look at a little data. So the prevalence of overweight and obesity, our target group, which was a grant requirement in that year, is 2 to 8 years old. And so this is the prevalence, overall prevalence of overweight and obesity, 29% across the region. And that is fairly high, higher than the US mainland average at that time. You can see a lot of variability amongst the locations in that level. So we are very diverse and have very different priorities. If you look by age, and this now is just the obesity portion of that overweight and obesity total, 14% on the obesity portion, you can see also differences by age, and clearly in the older age groups is where it's starting to get more and more of a problem. Looking a little bit at the diet, macronutrient, the carbohydrates, the fat, and the protein, percentage of energy above the recommendation. You can see kids are by and large getting plenty of protein, too much really, and also carbohydrate, less actually fat. So the interesting distribution there. When you look by food groups, a lot of grains, a lot of the energy is coming from grains. Next meat, so this is the carbohydrate and protein, very much less fruit, and vegetables and milk very low overall. Without going into detail, let's just focus on the overall here. So the foods that were consumed in the meat category, the most frequent meats, chicken, sausage, eggs. Then comes fresh fish, then canned fish. But as you look across these jurisdictions, and these are organized from the lower middle income up to the higher income, you can see more fish in the lower middle income, and more of the chicken in the upper income. Same basic structure here on grains, lots of rice, pretty much everybody eating rice, except for Alaska. Then white bread, white rice, white bread, some other cereals, and other breads and crackers. You don't see too much else on this. The way this These data are organized according to USDA guidelines. The starchy vegetables are a vegetable, so they show up here. So here's the vegetables. So the most frequent vegetables was a mixed vegetable, then potatoes, actually the soy from soy sauce, onions, and then finally the tubers. Although you can see in these lower middle income jurisdictions, you do see tubers as number one, but not in our not in Hawaii, nor many of these higher income jurisdictions. Fruits, banana did make it to the top. Of course, it may not be local bananas, but a banana. So that's pretty much across. You see some banana, and then apples, fruit juices, oranges. You do see coconut as the most frequent fruit in some of the jurisdictions, which is not surprising. And finally, milk, 2% milk. Interestingly, top milk group item in Chuk was ice cream. So not too much milk drinking in a lot of the jurisdictions. So here we have a measure of diet quality. Without going into it, it's a score that puts together the food groups. The higher the score, the better the diet quality. So the total possible is 100. Nationwide, a good score, an average score is also around 55. So we're in line with overall average nationwide, but you again see the variability. Higher scores among these higher income jurisdictions, I'm sorry, they're now on the left, and less high among some of the lower income jurisdictions. That's just some of the descriptive data that we've gathered. There has been no other data collection in the region of diet. So this has really become foundational information. And what many people don't realize is that when there's no diet data for the national programs, when they build national goals for school lunch, for other meals, they have to do it on the foods that are in the database. They don't know what is being consumed in our region. So it doesn't get considered in development of those guidelines. So we continue to try to work with them to get some of our data into the national system. But right now it's just telling our local people what we have in order to guide programs and policies. So, so now we're going to talk about the intervention, the trial, and we built this trial according to the social ecologic model, as I mentioned, to both target the child, but also the family, the community, and the environment and policies around them. So we took measures at all of those levels. And on the children, we measured their anthropometry, height, weight, and waist. This acanthosis, here's a picture of it that we observed at the back of the neck. Sleep disturbance, screen time, accelerometry, which is activity, and logs for food intake, and also for the activities that children were doing. So the study design was a community randomized trial. So rather than randomizing individual children, we randomized the communities to different approaches to doing our trial or not until the delayed optimization for those who were controlled. So we prioritized communities that were had at least 25% indigenous populations. We paired and randomized 18, so 9 intervention, 9 control, and then we had 9 temporal communities that were just there to give us a sense of what was going on with these measures without any of our active involvement in intervention. And so the intervention was about 2 years long, and then that 6-month delayed trial. So just descriptively, these are the children we measured. We measured thousands of children, predominantly a little bit more in the younger age group, pretty even on the sex, high percentage Native Hawaiian Pacific Islander, quite a few children also mixed, 20 odd percent. So again, emphasizing our social ecological model, we also talk about that as being a multi-level model and a multi-component model. And then this positive deviance approach. So building on what works, finding people in communities that are doing great things and helping them to do more. And particularly prioritizing the healthy indigenous activities. So to develop our trial, we built from the literature, evidence-based practices from the literature, but also blended that with what we learned from communities. And so we had meetings where we worked together to put those together according to what we felt was most important and most doable. And so we came up with a template targeting these outcomes. Decreasing sugar sweetened beverages, increasing water, increasing fruit and vegetable intake, decreasing screen time, increasing sleep, and overall increasing activity. So this is our template. So every community intervention worked to implement these things that we decided on. And they each did it a little bit differently depending on their community. But they did something for each of these items, and in order to address our target behaviors. So this was our map that everybody worked from. These again are our target behaviors. This is our Hawaii version of some of the social marketing material. This is the intervention activities presented here. Oops, I'm sorry. In categories, so policy and system change, messaging, environmental change, training, and messaging. So this just shows the activities across time from the beginning of the intervention till the end. Obviously, it took a while to get things going. And how it broke down. So a lot of environmentally focused activities, we're talking stores, parks, things going on in the community, social marketing, training, and policy change activities. This is the smaller list of things that were done for the control communities, the delayed intervention, so that they had some opportunity to participate after we'd already collected our follow-up data. So to cut to the chase of our results, looking at overweight and obesity prevalence, difference between intervention and control, overweight and obesity prevalence decreased significantly by 4% in intervention communities. Also, the waist circumference decreased significantly, as did the prevalence of the acanthosis nigricans, about 2%. Interestingly, on an individual basis, really none of the behaviors were significant, although the sleep disturbance and screen time were among subgroups. And this can be understood as it's very likely that it took all those things to make the change, or at least parts of all of those things to make the change. But I'll be talking more about that. So we did see some improvement in sleep disturbance among the 2 to 5 year olds and among the males, and also improvement in screen time among the older children. So this shows then the effect that I just spoke to you about. This decrease in the intervention communities of overall prevalence in communities, while the control communities increased. So I'm really jumping ahead here and showing you also time 3, which is 4 years later, when we just came back on our second grant, to see what happened after we were done with the intervention and really were not in any kind of active intervention activity. Because our goal had been to fundamentally change the communities, build capacity, work with people who were continuing to do things. And we were pleased to see that indeed things continued to get better. Obesity prevalence continued to decrease in intervention communities, while it continued to increase in control communities. So now, we have, as Walter mentioned, moved on to this new grant where it's called, we call it for shorthand, Child Food Systems, Resilience in Food Systems for Children's Healthy Living. We're going back and looking at all that data to focus in on the food behavior and the food system. To try to model and better understand some of those nuances of changes in the diet and in the community, and also work with communities at understanding that. So we're doing group model building with communities, again, around the food system. So we have our model from the trial. We're thinking about new components that maybe we haven't focused on or even hadn't measured that we can bring into that modeling, and looking at who our partners are, and actually looking at things that we hadn't specifically measured. A lot of it, our external advisors called us, said that we had created a movement, which I took as a positive thing because we were looking for fundamental change, right? So, you know, how do you measure that? So we're looking at measures like collective efficacy and actually just the training itself. We trained a whole group of people who have gone on to do more in their communities. And some of that's really hard to capture, but we are trying to capture it. So that's what we're up to now. Some of this expanded look at the data. We're pulling out some new ways of looking at these groups and their relationship to overweight, obesity, and acanthosis. So we do see that there was more overweight and obesity among those who were consuming more grains, significantly so, and who are consuming less milk. This gives us some clues as to diet composition that maybe could improve, and that was true generally with the acanthosis as well, particularly on the milk. We also found that with the monounsaturated fat, that more of the monounsaturated fat was associated with more overweight, obesity, and that our highest source of monounsaturated fat was sausage and frankfurters, which are common in that little cans in the region. So this is the framework that we've been using from FAO to think about the food system, but we are clearly honing in on sort of the area we've been working in, though very interested in where we touch others in the system. So this is really the consumer behavior, the diet, the food environment, and then its health impacts, along with the policies that influence those is our area of focus. So we've redrawn this. This blue are those same boxes I just showed you on the previous chart, but this orange shows you places where we already have chill data. So we're doing some modeling of this and looking at these connections and ultimately at some of the system dynamics of these components. These yellow are things that we did not particularly focus on or have measures of that we're interested in gaining more information about and considering in this modeling. And we have a new crop of trainees. So we, on the first grant, trained 21, 2 from each of the most of the jurisdictions. And on this grant, we had funding enough for 5, 1 from each jurisdictions. And they are here now. They just started in fall. They are all women, by the way. So we may want to connect you beyond this. So Jennifer from Alaska, Pauline from American Samoa, Hannah from Sinai, Christy from Guam, and Christina from Hawaii. So with our systems thinking, we're working with these students again. You know, training has been part of our approach. I mentioned the group model building activities, and then we will also have some pilot awards through in collaboration with Extension as part of this grant for each jurisdiction. So to sustain CHIL, I mean, we've been grant funded, right? And yay, we've gotten funding, but yet we don't, again, we really want sustained systems change. And so we've been working with the college, with the other colleges as well, to build infrastructure, to train, and to really have the infrastructure for long-term sustainable change. We have identified a key role of ours as being the data center, that a lot of the other jurisdictions don't really have the facilities or the capacity to work with those data. So we try hard to make it available and to keep it in good shape so that it can be continued to be used, because again, remember how precious it is, because there is no real other data like this. I mentioned the multi-state. We also have built a summer institute of online classes offered through Outreach College. So these are available to the region as well as to folks here. We've had dietetics grant, and of course I mentioned the food systems grant. These are the classes that are offered online through the Summer Institute. And this is our website. We try hard to keep things on the website, that we publish papers as well as some visualizations so that people can get basic statistics on prevalence of obesity in the community and things like that. So visit us there if you're looking for things. This is where those findings are in different kinds of shapes. And then this is where the data is organized. And Rika is our data manager. So now you know her. So the data can be requested. We do have a lot of procedures because it is considered private data. And so we either have to protect it, take away, strip away all identifiers, or make sure that the people who are requesting the data can securely work with it. I want to mention some of the key collaborators. This also across the university was across CTAHR, but also across some of the other institutes here at the University, the Cancer Center, Public Health. The bold is people who are on collaborators on the grant. The italics are people who trained on the grant. And some of them you'll recognize as now being faculty or in other staff positions. And we also hired from the freely associated states, and in those cases, we actually hired them as RCOH-UH hires, but they were typically part-time or with NGOs in their jurisdiction, or in some cases with departments of health. So University of Guam, University of Alaska Fairbanks, Northern Marianas College, American Samoa Community College, our degrees, and literally hundreds, probably thousands of community partners. We did receive an award from NIFA for partnership, for being a grant that promoted partnership. So that was in 2019. And I wanted to end with this statement that I liked from the WHO. Healthy islands should be places where children are nurtured in body and mind. Environments invite learning and leisure. People work with age and dignity. Ecological balance is a source of pride. The ocean which sustains us is protected. One of our kids from that. I'm sorry, from Pulaski.
Oh, entertain questions?
Yes.
Okay, you showed a picture of somebody with a rash on the back of I forgot the name of the disease. what causes it, or why is that an indicator of anything?
Yeah, good question. So it is called acanthosis nigricans, and it is very much associated with obesity. So it is very similar to the early phases of diabetes, where insulin is not being handled properly in the body, and that is essentially an eruption, a rash that results from that condition. So if you were to take insulin levels, you would find that they were too high. It's insulin resistant. So
Insulin levels are too high because why?
because it's not being absorbed properly.
So what are the levels that it may be too high from what you're talking about, working on the level of shops, stores, that
Yes.
With, of course, here in Hawaii, in Alaska, that's a little bit harder to
Yeah.
stop McDonald's from making
Yeah.
Big Macs. But in the others, was that a significant part? And if so, how did that compare? How did you do that?
Yeah.
Or in the other jurisdictions?
Excellent question. We very much worked with stores, and indeed the big chains are harder. The smaller stores, which actually are more predominant in our communities. These are, for the most part, smaller communities. For example, in Hawaii, it was Waimanalo, Hilo, Molokai. Well, they weren't intervention. So Waimanalo, Hilo, and Nanakuli were our intervention sites. So they were the ones where we were actually working with stores and so on. So yes, we worked on food placement in stores, trying to get more fresh local produce in stores, what kinds of signs were on stores. My favorite example is actually from the CNMI. I think I've told Rika that one of our community members was a store owner, and she just made the decision she was going to only sell what she defined as healthy food in her store, and just stop selling alcohol, stop selling all kinds of things. And she actually did really well because it was a small enough community that she became really well known for that. And so she was like a novelty and did really well. So absolutely, work with stores was part of what we were doing. Also, similarly with parks. Parks are in all kinds of conditions across the region. And that was actually a favorite activity. I think it's one of the things, in addition to the food, I'd like to understand better is get more into that environmental data, because they put a lot of work into building safe places for children to play. What we might call a playground, but they took all kinds of different shapes and sizes as to what that meant. And a lot of it is controlling stray dogs in the region, so that the children can play in a safe place.
Can you provide some additional examples of the kinds of interventions that communities used?
Well, here in Hawaii, many of you may know Ka'ala Farms. They were a key partner. Eric Enos was our leader, and he hosted many school groups to come to Ka'ala Farms as a learning activity. It's a cultural learning center. So he would they grow taro there. They would get in the lo'i, and they would pound poi and have experiential activities. And so similar types of things were done in other jurisdictions, with providing children opportunity to interact with some of these foods. Gardening was one of the activities. I don't know if you caught the one picture, the little girl that she was actually from Hilo with her watering can, and had her responsibility to water those plants. We find that those experiential things, and especially, again, building on things that people are already doing, because if otherwise they're really hard to sustain. I mean, anybody who's had a garden, you don't do that just trivially. You have to really keep at it. And so really just, so what we do would be provide additional funding, but also encourage that person. A big term we used was role modeling. And sometimes it was a child, and sometimes it was a teacher, and sometimes it was a politician, but someone who was doing something, and we just basically encourage them to do more and help them to do more, who are already from the community. So, yes.
How do you control, if you said that they eat a lot of meat, so I'm assuming that that meat is hot dogs, Spam, Portuguese sausage, all of them are full of nitrates, or nitrates, I guess it is. Those are really bad for us. Our whole population eats those.
Right.
Hot dogs, I'm sure, are number one in
Right.
at lots of events because it's cheap and it's easy.
Right.
But how do you decrease that if it's cheap?
Yeah, well, that's a really important question. That's really one of the hardest ones. That's what we're looking at more now with the food system. But I mean, one way is through demand. When people want the other foods and you try to help provide the opportunities to create more healthy local foods, then the goal is to shift that. But this is also where policy comes into play. And many of the jurisdictions are looking at policies of either taxing, say, the sugar sweetened beverages, or it could be the canned meats, as one approach. I think ultimately policy is going to have to come into play for that one as well. The other one that people are trying to do is get shifted in some of the food assistance programs. Those are big policies that have a big impact and an opportunity to make a, fairly significant shift, even at school meals. And so I was hesitating around the starchy vegetables. The Hawaii has gotten the taro to be considered a whole grain for the food plan in school meals. And so been able to work it that way. Our Pacific concept of food groups would put it more there. It clearly has a lot of carbohydrate. So these are some of the challenges we have in working with all the different institutions and finding some common language. But these are a few of the ways that we're working. That's why we're interested in the food assistance programs on our food systems map, because we think that is actually an opportunity to make a significant shift.
I have a question from Billy online. They say, I'm curious how soy sauce was the #1 most consumed vegetable in Guam and CNMI. Was this added to rice? ?
Yeah, no, I know we were all scratching our heads on that, and it's actually the soy. I mean, soy is eaten in a lot of food. It is soy sauce, but it's also, dene, it's also other similar sauces that contain soy that are used with the rice, but also with the meat and other dishes. So yeah.
It's also a filler, isn't it?
The soy, yeah. Although it was actually soy sauce that was came up on our list. So, but we're continuing to look at those food data, as you can imagine. If only people only ate one thing, it would be so much easier. But diets are very complicated. So to really work with those data and look at them in a variety of different ways is a lot of what we're doing.
I did notice that sugar is really bad for us, and yet there's sodas. So I noticed on your list that sugar showed up as one of the highest, but making that change, oh my God.
It's amazing though, with young children, if you give them other experiences, how much, experiences eating other things, how much that can help. But of course, there's the world around them, what's available to them, what their parents provide, what the school provides, how easy things are to get. So that's why we're trying to work at all these different levels.
Because their fruit was lower.
Yeah.
So maybe if you get them to like fruits more, maybe that
Exactly.
white sugars will go down a little
And if
bit.
they grow it and then they're like, oh, I do that, and those kinds of things help. But again, I'm all about the policy piece as well. But it helps to have data showing the foods that are associated with the obesity and so on to argue for that policy. And that's a key piece for all of us to have just basic descriptive data points to be able to say to whomever, whatever policy, whether it's school policy, federal policy, we need to do something about this and show an example of what can work as well as what the problem is.
So we invite our online audience to unmute if you want to ask a question live, or Jesse, do we have any
I'm having them do it in the chat
additional
because I don't know
questions
if there'll
there?
be feedback on the thing, so I
Okay.
needed that. Sorry, I'm not kidding.
Just curious, would be measuring blood pressure, would that be any, is it important for children at such a young age?
Oh, it would be great. And actually, in one of our previous studies, Pacific Kids Dash for Health here in Hawaii, we did. And we actually were able to show changes in blood pressure, but it's the environment we're working in. To do a good blood pressure measure in all of these settings, the measures we have were easier.
Yes.
It would be a good next step, and it's still relatively non-invasive, which, taking blood from young children and so on, especially in community settings, is also not easy to do. And as some of sometimes we really limited resources, even, water and refrigeration and light sometimes. So,
What do you think was the key to that long-term success, the not backsliding into old habits?
yeah. So as I implied, I really do think it's that positive deviance approach and really the communities owning and changing and continuing to build. We worked with people locally who continued to do more, do new things, train new people. And so I think it's that sort of snowball movement effect that helped it, because that is, most programs have that problem. As soon as the research is done, then we go back to where we were. But we were really focused on, the different levels and really changing the environment for that reason. So I think you have to be focused on it from the beginning for it to work.
I think it's exciting to think that
Yeah.
you can make a change, that it
Yeah.
really can take hold.
Yeah,
It's easy to get pessimistic, I think.
yeah. It is challenging though. I mean, we did so many things, the shift in the way of thinking about things, many scientists will want to get down to that one thing that made the difference, but I don't think it was one thing. I think it was a combination of things.
So I have a question. So the control groups, do they stay the control groups forever, or did they get to cash in on some of this good stuff at some point?
Right. So as I mentioned, we had that delayed intervention. So it was a mini intervention that we did with them. But then, the grant was over.
Yeah.
So, for everybody, we did have to leave, but we actively planned for that, what's going to happen, when. And then when I say leave, again, it was mostly local people doing the work, but the money ended basically. So anyway, the control group got a 6-month mini intervention of the things that we thought were the best. So actually that in principle dampened our effect, right? Because in principle, it would have been worse if they didn't have anything. But Because we were comparing intervention and control over the long haul, right? And we did some intervention and control group.
And if I understood correctly, the control groups were actually getting worse. They weren't just
Yeah.
staying,
Yeah.
staying.
Right. So it can, we weren't measuring throughout, so we don't know exactly when it's got worse. So, whether there was any bumps along the way, but yeah.
Do you think that, getting the parents involved in that community made a big difference? I would think that if you got the parents to cut back on the thing, then it would
Yeah.
have a direct effect on children.
Yeah, absolutely. Many of our activities were with included parents or were, like parent engagement days at schools, and many of them were targeting the parents. So absolutely, yeah. And I mean, an interesting question is, did the parents themselves get better? But we weren't
Right.
measuring that.
Yeah.
Yeah.
I would think if you got the parents to lose weight
Yeah.
or lower their diabetes levels, then you would it would happen in the kids too.
Perhaps, however, my experience is that the parents are more motivated to do something for their kids sometimes than they are for themselves. So it works the other way as well, okay, so maybe this would be good to try for the child. And it ends up being good for them too. So, yeah, I mean, you can go at it both ways, I think, but
They have more control over their kids than they do over themselves.
right.
Wendy.
I wondered, the Pacific Islander population that you work with, their food source is mostly brought in.
I wish I knew better, but yes and no. I mean, they are heavily reliant on imports, but I would say overall there is still a proportion of subsistence that's higher than, say, what we have here. They get about one. It depends which one, but the ones that were not our intervention, so the freely associated states, the Federated States of Micronesia in particular, they only get about one boat a month. So it's, and sometimes it can get disruptive, and
Is
so
there an initiative for to use more of an indigenous diet, or to encourage farming?
Yeah.
Or any of that?
well, so there's definitely a sociocultural phenomenon that varies across the region. We refer to that as nutrition transition in our field, where, now in Hawaii, there's somewhat of a resurgence of interest in tradition and recognizing the healthfulness, and but there was a period where not as much. And I would say many of the jurisdictions they're starting, but many of them are still very interested in those modern foods and, things that other people have. And so it's mixed. It's very mixed everywhere. It's something we're trying to get a better handle on.
There is a big movement here.
Yeah.
In farm to school
Right.
programs and early childhood programs, using gardening as part of their curriculum, and elementary schools as well.
Right.
It's more healthy diet.
Right. And it can be very motivating. It's a great strategy. And that's why we were, one of the reasons we articulated that we wanted to focus on the indigenous, because presumably we can learn a lot from the indigenous ways, and that there were things about the indigenous ways that would work in the communities. And so we considered that part of our strategy, but
that was a big push in the local plant population here.
Yeah.
To more involved with the
right,
healthy diets from the original.
right. It's hard though. I mean, as we know from the Shintani diet, I mean, it can work, but if you don't have that around you to sustain it, I mean, that, meals were being provided, cooked, they had group setting. Once that was over, it was rebounding. So, yes. Yeah. Thank you.
I spent about a month on the island of Koror many, many, many years ago. And I actually, the only kinds of things that seemed to be available to eat were lobster by the bushel and hearts of palm. And that was the only vegetable available.
Wow.
Much. I never was happy, never in my life was happier to get to Guam and check in and have a salad bar. Because
Yeah.
I had been deprived for a
Yeah.
while, but I didn't notice lobster was high on the list.
No.
So I'm assuming that we depopulated the lobster population and it's no longer that much available.
You know, I don't hear that much about lobster. There are, of course, fish was a broad category and there were a range of fish in there, but I don't. Rika, do you remember seeing lobster? I don't remember seeing lobster
Like one may have a lot of
on pig.
but it's spiny lobsters.
Yeah.
The ones we have here.
Yeah. They're easy to get by still, but I don't know now that the FSM has a big fishing industry. There's a lot of fisheries from outside countries that are there and they're fishing a lot
Yeah.
in those waters. So I think that's one of like the biggest concerns right now.
Thank you.
Walter.
Go ahead, somebody was gonna ask.
I had a question from Lara
Okay,
online. Sorry, Lara was wondering, do you think NHANES,
And
NAES,
Haynes.
will begin to look at these locations in the future?
Oh, Lara, such a sad story. So we actually managed to get them to come to Hawaii. And we're planning with them to survey Hawaii and then cover it.
Oh,
And so we got removed from the calendar. And actually, Haynes themselves is having a hard time right now, even on the continental US. But basically, we're told we're no longer on the calendar. So they have never breathed a word to me about the other islands. They have part of what happened. So the last dietary data that was collected in Hawaii was in 1978, and it was a household survey, just diet. Not this was before Haynes.
sorry,
Then-
what is it?
Haynes is this survey that collects the diet, but they also collect all kinds of other health information. And so what happened is they merged with Haynes. So the diet piece merged with the medical piece. And which sounded good, if you have it all together on the same people, but that it meant it was this huge survey and it had involved a mobile unit. It's like a tractor trailer. And so the big excuse is it's hard for us to get it to Hawaii. So they were going to do it. We actually had arranged to have it out here by the Korean building.
Oh.
Yeah, we were working on it. But it's still a problem. They were only going to do Oahu because of the transportation issue. And it would be really hard to get it to the other islands. So I've talked with them about, doing something more mobile, but I haven't gotten very far.
Is there another one online?
Yep, that was it.
Okay,
Thanks,
I'm just thinking in terms of scaling up these intervention opportunities. And you also have an international clientele, right? You're working across different countries in addition to the insular US islands. Have you done any work with the World Food Program in any of these places?
I have, but not, recently. So actually, before I came here, I was working in the Dominican Republic, and my job was to test different strategies for delivery of food assistance to communities.
Well, then the follow-up question is about the school feeding programs.
Yeah,
Because not from the perspective of teaching the kids how to grow their own food. I mean, that's important.
Mhm.
But primarily using this structured demand of schools to encourage better production of nutritious
Yeah.
food
Yeah.
by growers that make enough money because they have this demand.
Yeah.
So the World Food Program has had a very active
Yeah.
school feeding program now. There's the Brazilian government put up the money for a Center of Excellence Against Hunger that really takes what Brazil has learned from the school feeding program, which is recognized as extremely well developed and very successful. They have a policy where 30% of the food that you buy for the school feeding program has to come from local producers.
Yeah.
Right. So then that's acted as an incentive for local producers to up their ante in terms of food safety, better production, using higher technologies that improve productivity. And it might be, well, the reason I asked him was whether there were school feeding programs that
Yeah.
potentially could be linked to demand through the school system.
Yeah, so it's highly variable again, and partly, I would say, proportional to the closeness of the affiliation to the US. I get asked every year to help build school feeding programs in Micronesia. There's a lot of demand for it, but there's no money. And so, I'm like, well, I'd love to, but I don't want to promise something I can't deliver on. I mean, you can think about it, but number one is, where is the food coming from? And how are we going to organize that? So it is, I do work with those groups sort of on a consultation kind of a level, advisory group kind of a level for how to organize those programs. So I think you're absolutely right in terms of learning from each other and so on. But this region it's kind of, they don't get a lot of attention from the international community because of their US affiliation, but they don't get a lot of attention from the US. So it's kind of a rough mix. Yeah, but I think absolutely, to learn from each other and try to include those strategies.
Well, in the island states, it's particularly challenging because you have smaller population and smaller land resources. And to come up with the quantity and the quality that you need for a dependable school feeding program is a challenge.
It is a challenge. Yeah, and one reason we've focused on resilience is, the other challenge is insults to the food system. Current COVID was one great example, but of course the more regular one is typhoons. And so that's the other challenge. And, I'm someone, again, that early job I worked for CARE. So that was World Food Program food. I've seen how the disaster response works and the intention, but I also see the fallout of, once you intervene, once you bring in all this food, when is it over? How do you take it away? And how do you, forget that you ever ate that? Or, so that end of things has become a concern of mine, sort of from a policy perspective and interest of mine. And of course, our spam is a great example, how do we take that away now,
Or because it's them beef away from people.
Developed a taste for it.
Yeah.
Well, I think with that, let's talk about food, maybe has people ready for dinner.
Yeah.
I want to thank you all for joining us, and this program will be available online. We'll send out the link when we have it posted. Thank you for joining us, the Zoom audience, and those of you here in person. How about a hand for